If you have injured your joint and even after taking a break from sports and other activities, you still experience symptoms such as pain, it could be that you're suffering from an undiagnosed sprain. To better explain what that is, let me show you the shoulder joint. This, what you can see here, is the humerus. Now, the head of the humerus is articulating with the glenoid fossa of the scapula. The scapula is the shoulder blade. This, which you can see here, is the coracohumeral ligament. And ligaments help stabilize the joints in the human body. What can usually happen is that upon an examination, the doctor does not notice that the joint is unstable in a certain position or during a certain movement. Normally, the patient takes a specific posture, when an X-ray scan or an MRI scan is performed, and we might not immediately notice that a ligament is ruptured. That is what the sprain is: an overstretched or a ruptured ligament. So what happens next? Well, the patient leaves the clinic, and soon the hematoma and the swelling disappear and everything appears normal. But the instability in the joint remains, and as the patient uses this joint or tries to bear more weight, become physically active, the symptoms might come back and the pain might persist. These ligaments must not always be completely ruptured. They can be partially ruptured, and that is where all these issues start. Joints are stabilized in different directions by different ligaments. These ligaments are different from joint to joint, and they have different functions. Ligaments are usually present on all sides of the joint, and they usually have their primary function during a specific movement or in a specific position. Besides these ligaments, additional stability is provided to the joint by the surrounding muscles, and this is not to be underestimated. So, for example, around the shoulder joint, there are muscles that we commonly call the rotator cuff muscles. They are a very important stabilizing component for the shoulder joint, and they do stabilize the joint, but that further complicates an accurate diagnosis of a minor injury or a rupture of a ligament. Through this temporary stabilization by the muscles, a joint might appear perfectly fine and healthy, but is it really? Why does it hurt? And this is where there are two things where doctors can truly help. Two things that I would like to explain. The first thing is a proper clinical examination that is performed in order to identify if a possible instability of the joint is present. Additionally, during the clinical examination, we might find that the patient experiences spasms of the surrounding muscles because of the pain in the joint or along the ligament. These muscles also can experience a spasm because they help stabilize the injured joint. A skilled clinician could be able to palpate ligaments from their origin all the way to the insertion, and the patient might experience pain upon this palpation. Now, not every ligament can be palpated, but if it can, it takes skills and knowledge to be able to do this. Before I explain this really second important thing that a doctor has to know and has to perform, I would like to ask you to help us reach other people who suffer from joint instability and pain by subscribing to this channel and liking this video. And I'm asking you to do this because YouTube and other platforms will simply not suggest this video to people suffering from these symptoms if we don't get enough of likes and subscriptions. That's just how their algorithms work. So you can help us inform other people as well. Now back to the topic. If you already subscribed, the second thing that can be done is to perform an MRI scan in order to identify which ligament has been injured. This is really important because an MRI scan is capable of identifying and displaying soft tissues such as ligaments in the human body. But sometimes it can happen that a ligament has torn a part of the bone as it ruptured, or a bone simply fractured in the near proximity of the spot where the pain is present. So it is really smart to actually perform an X-ray scan first in order to exclude a possible fracture. It is really important to have complete diagnostics performed in accordance with the guidelines published by the American Association for the Surgery of Trauma, because workouts, sports, and training sessions using your joints without properly identifying what is causing the pain and instability can irreversibly and permanently damage your joints and also progress to a much worse scenario in which the joint becomes immobile. It is not easy to perform these clinical examinations because every joint is different, and it is not easy to understand and properly analyze these medical imaging scans. So we can all benefit from these videos. If you're a doctor and you want to make videos like these, then go to anatomsky.com. But if you have more questions about pain and sprain or joint issues, then go to symptomsky.com/help/sprain.